Green here. Good morning, Dan. How you doing?
Good morning, Howard. Thanks for having me today, and it's good to talk to you and good to see you.
Good to see
It
you.
has
And
been a while. Yeah.
it's been a while since seen it. Probably since April, since we've seen each other in person. Maybe I don't know. I can't remember us bumping into each other over the summer. So Dan, I appreciate you're taking the time to come on. I know it's a very busy time.
Good morning, Howard. Thanks for having me
Oh,
today.
I got an echo. Let me
Good
fix it.
to see you.
Good to see
It
you.
has been a while.
There we go. So Dan, first of all, so yesterday's COVID numbers from the county said 13 people are hospitalized. I imagine that it doesn't necessarily correlate with how many people your hospital has in the number of COVID patients. Tell us kind of where you're at right now as far as dealing with COVID at UMMC.
Sure, absolutely. You're correct. Just county residents by their zip code, and they don't necessarily mean it's hospitalized locally. We're seeing about 8 today. That number has fluctuated between 7 to 8, up to about 11 over the last 3 weeks or so. So yeah, we're seeing some of that 13 at our hospital. I would say about a half of our volume is from long-term care facilities that are at our hospital today, and then the other half are more residential folks that live in the community and are in because they need more acute medical care.
And I remember from the spring, it sounds like the numbers you're giving now are not, you have plenty of capacity, but maybe just address capacity and how concerned are you if, trends continue the way they are, being able to keep up?
Yeah, I believe what we saw was a little bit of a different ramp up now compared to what the spring was. We saw in the spring our graphs looked like we had an earlier blip and then a plateau and then an increased rise. When you look at the source where patients came from in the spring, more of them were from long-term care facilities occupying the inpatient beds. This time, when we look at the source region-wide, it's definitely more split with a higher percentage, or at least an even percentage of community members versus long-term care or residential living members. So, and it's been more of a straight, steady incline this time, less of a plateau than we've seen before. So that obviously does concern us. We want to make sure we're able to focus on the availability of beds going forward. Generally, as an average rule, in the month of November, I've seen about 10 more inpatients than I saw in the month of October or even across the summer. So, a net increase of an average of 10 patients in house. Certainly manageable in our volume, but we want to watch that trajectory and make sure it doesn't continue. And we've built a lot of planning around it. We learned a lot in the spring. We're able to take those learnings from the spring and apply them to our response plan here in the fall. So we are watching that very closely. Our health system has a daily incident command call, and we look at the data every day across the region. And then locally in Batavia, we have incident command calls 3 days a week, and then ad hoc as needed. And so every one of those calls begin with a recap of the data, both the community prevalence, the hospital prevalence, as well as we look at Erie County and Monroe County as the two major centers east and west of us that we need to pay attention to. So a lot of data crunching, a lot of watching the numbers, looking at the acuity of the patients, and really seeing a lot of outpatient flow this time. Our urgent care has gotten markedly busier, and in the spring that wasn't. Did a lot with the tents there, and we've been able to make some adjustments this time around, hoping to stave off some of those bigger measures that we've had to do, to try and manage the community prevalence of it.
I wanted to ask you about those tents, and that just feeds into the other question kind of in my mind. Is in the spring, it seemed we're dealing with this new disease, novel coronavirus. Not a lot's known about it. We don't know how it's going to impact our community, and there was a lot of concern then about enough ventilators, enough beds. The concern about hospitals being overwhelmed. We talked a lot about flattening the curve. This time we're seeing much higher numbers, but I'm not getting the same sort of the messaging isn't the same sort of urgency. And I'm just wondering kind of what's changed, how you feel better prepared, how you look at the disease differently.
Yeah, Howard, it goes back to looking at what we did actually see in our region, what's maybe different upstate than maybe was what we were relying on in the spring was what we saw happening in New York City. And we saw some extreme situations occurring there, and we prepared for those. And that created the sense of urgency in the spring to be ready for that. And now we've been able to understand more about the illness. I think treatment modalities and some of the medications being used to treat the illnesses have evolved, and we've been able to have that on hand. And so it's changed our perspective of what we need. We're still looking at ventilators. We haven't taken our eye off of that. We've ensured over the summer months to be able to acquire more ventilator capacity within our health system, and that translates to more ventilators available in Batavia if needed. And we still have our bed capacity plans. We did a lot of work on that in the spring. All of those plans sit ready to be activated. And so, really it's all in the forefront, but we've had different tools to work with since the spring, mainly some of the treatment modalities and a lot about how we understand about this illness and what people can do. I think a word that isn't being used as often is flattening the curve this time around, but I think it really speaks to what we did to flatten the curve are the things we've asked everybody to continue to do. And that's wear the masks, social distance, wash your hands, stay home if you're sick, call your doctor. Don't run to the offices or EDs or urgent cares, but call your doctors. All of those things worked in the spring and they can continue to work now. But we have to recognize our community and our state and our country have seen some fatigue around this as well. And I think that's also a factor in what we're seeing in fall here.
Let's see. I changed my audio settings. Hopefully, everybody can hear me a little better. Can you hear me any differently, Dan?
You sound great, Howard.
Okay. So you touched on the fatigue, and that's the other thing I was thinking about. And maybe you want to just kind of when our community health leaders, how you see that the community attitudes have changed, and if at all, and what you think we all need to be doing better.
Yeah, I think it really is. I think there was in the spring, people again, not a lot of knowledge about the illness, a lot of really scary stories that I think help people react to the immediacy of what happened. There was a rapid shutdown, not a more progressive plan. All of that appropriate and needed at the time. And I think what's happened is we've been at this, 8, 10 months later. And I do believe people have started to have fatigue around it. They don't want to be isolated in their homes, and they've started to come out. And we saw that in the fall as people were starting to get out and about more, and over the summer. And I think we've seen that where people gathered. And I know Paul Pettit from the county. He's made comments about the fact that there's been gatherings and they've been contact tracing from that, and it has. I think that fatigue is related to that. I think it's this constant balance of what people need to do socially and how they need to sustain their psychological feelings in this time to what's the best way to protect folks until we reach that herd immunity level that will come with a vaccine and what we hope to see in the coming months. But it is contributing, I believe, strongly to what we're seeing today. And we have to ask people to double down at this point to really wear those masks and refrain from getting into those large social gatherings where you can't control the interactions as much. And that's a hard message, Howard, right now, this week. Like tomorrow is an important day for a lot of families, and Christmas is coming. That's an important time for a lot of families. It's a hard message to ask people to say, change your plans, don't expose yourselves. But it's an important one that we can't forget.
I'm sure it will be hard on a lot of families. So just for our viewers right now, I'm seeing Dan's picture frozen, but still hearing audio fine. So I think we're doing okay. Dan, one of the things I want to touch on is we're also coming into flu season. What are you seeing there, and what are your concerns of flu and COVID coexisting?
Well, we made a big push throughout our health system to get early flu vaccination and get the word out there to get that. We wanted that to be as little of a factor as possible in discerning COVID versus flu. And so we did make that really big push locally at your local hospital here. 95, well, it's actually up to 98% of the employees have responded to the flu campaign. And obviously some people can't get the vaccine, and so those folks noted that, but a huge chunk of that, 90% or better, did get the vaccine. I think it's a huge piece of it, and it's important for our community to stay the course on getting the vaccine. There is some flu numbers out there. There is some flu cases happening, but for the most part, I think even traditionally now, we would just be starting to see some of the flu emerge in a normal year, not 2020. And so we're really watching that closely and hoping to avoid as much of that as we can. But I think it's something to keep our eye
on. So Dan, the other thing I want to talk. Just a comment first. This is the first year I've gone. I go for a flu shot every year. Both Billy and I always get flu shots, and this is the first year we've had to actually wait in line to get a flu shot.
Yeah, I think that is a good comment, Howard, and I think that's speaking to the fact that people are listening and they're talking to their doctors and they're getting the vaccine as they should.
And we just might want to emphasize too: if you haven't gotten your flu shot, it's not too late. They're still available and they'll still be effective.
Yeah, that's a great point, Howard. Thanks.
So and speaking of vaccines, so we've seen a couple of trials now that are reporting 94% effectiveness. The data is still, of course, preliminary, but it looks like there is going to be ramped up distribution and approval and distribution of at least one of these vaccines. And I believe the Pfizer one requires this incredibly cold storage. Just wanted to touch on UMMC's readiness to distribute vaccines, whatever may be coming.
Yeah, absolutely. And this is really the great part of us being part of an integrated health network, Rochester Regional Health. Right away, as soon as we had intel on vaccines and what the requirements were going to be, our supply chain team were on it. Orders were placed for many minus 80 freezers to be deployed to particular areas around the region, United Memorial being one of them. And so really now it's the waiting for the vaccine to roll out, getting the freezers in. Those are still coming. So, but when we have a distribution plan. When they come, make sure that it gets out in accordance with the state requirements, because the state has requirements of how they want vaccine distributed, as well as the federal government. And so we'll work within all of those. But being able to rely on a larger network to be able to make those big purchases, get them going, have been crucial. So it's definitely we're going to be ready for it. And we're going to get it out there. It's an important piece. We're very encouraged by the data we're seeing. We're very encouraged by the ability to get a vaccine out this quickly and be able to get it into the community so that people can, hopefully we can get to that, as we call it, herd immunity. By getting enough people vaccinated, we'll be able to bend this curve again.
Of course, we know you have a very dedicated staff. With things kind of ramping up, how are they holding up?
Oh, Howard, they're fantastic. They've really they've flexed and bent and worked in different roles, different areas, all the way through this, starting back in March and even now. In the last couple of weeks, as we've seen the numbers, we've called them to step up and help out. We've had to add some staff to our urgent care piece because of the volume over there. We've opened up a testing trailer over on our Jerome Center for doctors who've already ordered the test. And we want to do the collection, and all of our staff have really just gone the extra mile to make sure that all those areas are covered, the patients are being cared for, and that our patients get the same high quality care that they've come to expect locally and and throughout the region. And they worked hard, and they appreciated the support from the community. The community has really stepped up and helped us throughout all this in a variety of ways. And our staff have really worked hard, oftentimes giving up their home life to be able to serve our community. We've been touched a little bit by some of the COVID, quarantines and whatnot, so that at times causes staff to be out of work for a period of time. But again, everyone else has stepped in, filled in the gaps, made sure that we're covered, and I know that they're helping each other out along the way. So, really proud of them, and really proud of the team we're doing. And I would say this Thanksgiving, it's one of the things I'm very grateful for is the team of healthcare workers that are working at our hospital throughout our community. They're really just making a difference, and we're very lucky to have them.
Well, I appreciate your time, Dan. I don't have anything else at this point. Is there anything else you wanted to add?
Yeah, I just want to. One other thing I'd just like to ask to help. Hopefully, you help me get the message out there. Is really just reminding people to call your doctor if you think you've been exposed or you think you have COVID. Call your doctor first. Your doctor can then direct you to the appropriate location. As I mentioned, our testing trailer is a location where your doctor can send an order to that trailer, and you really don't have to interact with too many people to be able to get the test done if that's what your doctor wants. And that also helps depressurize the urgent care and ER, so that those places can be kept for those that are needing a little more attention or maybe don't have a doctor. So if we can keep the word out there. And then the last thing is, thank you, everyone. Thanks for washing your hands, wearing your masks. Thanks for social distancing. Thank you for supporting your healthcare community. All those steps make our jobs easier and help us combat this disease. And Howard, thanks for giving us time to talk about it today.
Well, I appreciate you coming on, Dan. Of course, this is an important public health matter, so we want to do our best to help keep people informed. So thank you very much.
Thank you, Howard. Have a happy Thanksgiving and take care.
You and your family as well. Thank you.
Thank you.
It doesn't look like you can hear me. Maybe you can hear me now. Okay. It's Howard Owens at the Batavian, signing off with another live stream interview. We're trying to work on getting some others, so stay tuned over the next few days. Of course, everybody have a real